Very, very welcome.
That sounds amazing.
It is amazing. You're amazing. Terence is also what we call a skin expert and a fatty expert. So any questions on fat, directed to Terence.
I just have to be told which one I press. That one there, I think. That's right? Yeah. Thank you for inviting me. It's a pleasure to be here. My experience that I'm going to tell you about is in Asia, India, a little bit perhaps in Africa. And in those countries, lymphedema is a very old story. As old as the animal kingdom. There are genetic, congenital causes. There is immobility, there's cancer, and there are infections, all of which have existed for a very long time. In humans, its therapy is recorded in China and India even before Christ. Now, in rural developing countries, many have no treatment because of the distances from expertise, or there's a long delay because of poverty and ignorance. I will, in the course of this talk, be showing you some very severe cases of leg lymphedema of the legs. Do not let that worry you. You will never get like that. This is, the reasons they are so bad is that these people have had no advice. They're not doing any of the appropriate treatments. And they are just sitting or lying, not moving, hardly ever taking a deep breath. And they get very, very severe leg edema. One of the causes is a parasite called filaria, which is spread by the mosquito. And 20% of the world population is at risk from being bitten by this mosquito. And about 120 million people have got filariasis in their bloodstream, and 44 million have a follow-up of this affecting the lymphatics. 25 million of these are in India. So the people that I'm trying to help, enormous numbers, 25 million in India. Of course, cancer in our country is the major cause, particularly breast cancer. And it's the therapy, surgery, and radiotherapy, as well as the cancer, which contributes to the problem. This is just a picture of the filariasis story with the mosquito biting. It gets into the bloodstream, and some of the parasites, which looked like this, eventually get into the lymphatic system, and they cause damage to the lymphatics. Many years later, people get swelling, not immediately. And this is the problem. The mosquito, the parasite, and the end result of 25 million people in India having bad legs. The mosquito and its transmission of this parasite is treated by taking certain pills. There are 3 pills which are effective, and 2 of these are usually given to the whole population where this mosquito exists. And it only needs to be given once a year. And so there's a huge, huge effort worldwide to eliminate this disease, to get rid of this disease by treating the population so that the mosquito does not transmit this parasite. But the treatment which gets rid of the parasite does not cure the damage that has been done to the lymphatics. So we still have to come in with a second program, which is treatment of the lymphedema. This is where you see filariasis, the red parts. And I work here and here. And this is a typical scene. Your clinic is full of people with problems with their legs, sometimes their arms, sometimes their breast, due to filariasis, and they are just sitting. I want to say a word about the mechanisms underlying lymphedema. All of the lymphatics in green drain into the big veins in the upper part of the chest. And they empty into these veins when the veins are emptied. And the veins are emptied by taking a deep breath and breathing out. It's what the Chinese call dragon breathing, because ideally you would say a little bit of forced expiratory volume. So, or chanting, la 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 la. That's a good expiratory effect. And it empties these veins and helps the lymphatics, the whole system of the lymphatics, to drain. The trouble is that if you just sit, you never need to take a deep breath. I also want to point out the difference. This is in the skin, this is a blood vessel, and this is a lymphatic. The blood vessel is thick-walled because it's having to deal with high blood flows, high blood pressure, whereas the lymphatic is very thin-walled. It doesn't have to deal with blood pressure. It doesn't have to deal with high flows. All it has to do is to be responsive to movement. And movement is the secret of the management of lymphatic failure. And the lymphatics have to be responsive to movement. This just shows what a lymphatic looks like under the surface of the skin. This is what we call the epidermis on the surface, and not far below it is a blood vessel, and then this long mesh of the lymphatic. And this has to be responsive to movement. It's so superficial that very light movements and a healthy lymphatic can empty it. It's also, and this is an elastin stain, surrounded by an elastic fiber which makes it responsive to movement. That is destroyed very often in lymphedema, and the lymphatics become less responsive to movement, but still you have to introduce movement and even more movement in order to have an effect. And this is my last slide on the anatomy. Again, the surface of the skin, the lymphatic, and these are elastic fibers which help this vessel to become responsive to movement, to have so-called snapback. Now I'm going to move to India with my colleague, Dr. Narahari. My colleague, Dr. Narahari, he's a dermatologist like me, who directs the Institute of Applied Dermatology in southern India. I'm using his slides. We work together. And we combine various systems of medicine. Our object is to treat the poor, because most of the patients that we see are from villages, and they are very poor. And we have to provide therapies which are available to them in their villages. And Indian medicine is available to them in their villages, and it includes systems such as Ayurveda, which is mostly herbal, and yoga. This is available in the villages at low cost, and therefore we have made great efforts, can't get back, to, how do I get back? Yes, that's lovely, that's fine. Yes. We have special steps of treatment and training procedures. The patient is prepared by a lot of counselling, a lot of talking. There's a lot of case history done. And because in India homeopathy is very popular, and because homeopathy has a very good system of finding out about the patient, it's probably the best system of medicine for asking questions. A good homeopathist will spend an hour talking to the patient, getting the history, getting their relationships with the environment, even with the heavens. We do not use homeopathy as a treatment, but we have decided, because it is so common in India, to use homeopathy as a way of finding out about the patient. And then we have various systems for measuring, same as your measurements here, with tape measures, with water displacement, and also photos. You'll be seeing some of the photos. They then have something in which we've integrated Asian medicine with Western medicine. And we are washing, but we're also washing with herbals. And we're also giving some modern dermatology